Hello, I'm Matthew Gavidia. Today in the MGH Life Sciences Medical World News, the American Journal of Managed Care is pleased to welcome Dr. Ethan Brown, Principal Investigator of the COVID-19 survey by the Michael J. Fox Foundation, and Vanessa Arnedo, Vice President of the Michael J. Fox Foundation and Research Cohorts. Can you both just introduce yourself and tell us a little bit about your work?
So I'm Ethan Brown. I'm a neurologist and movement disorder specialist at the University of California, San Francisco. I see patients with Parkinson's disease and other movement disorders.
And I'm Vanessa Arnedo, Vice President of Research Cohorts at the Michael J. Fox Foundation for Parkinson's Research, which is the world's largest nonprofit funder of Parkinson's research. We exist to accelerate the development of better treatments for people living with Parkinson's and ultimately to find a cure. And I lead a team that focuses on that mission by developing open access cohort study data that researchers can use to help identify better measures for Parkinson's disease to accelerate therapeutic development.
And Vanessa, just to get us started off, can you explain the Michael J. Fox Foundation's online clinical study, Fox Insight?
Sure. So as you can imagine, in light of the pandemic, many clinical trials have been paused for enrollment or have moved to remote or virtual models for visits during COVID-19, but there are still opportunities to get involved in research. So Fox Insight is an online clinical study launched by the Fox Foundation back in 2017. And this study aims to learn more about the lived experience of people living with Parkinson's or family members of people living with Parkinson's. It's rapidly become the largest Parkinson's cohort globally, with more than 48,000 participants enrolled in the study today. Participants complete study visits, online surveys about health, symptoms, lifestyle about every 3 months. And the foundation launched a Fox Insight survey in April that aimed to understand the impact of COVID-19 on the Parkinson's community.
Ethan, can you discuss how the Fox Insight COVID-19 survey was conducted? How was patient data derived and what type of questions were asked?
Sure. So I think the most remarkable thing about this survey to begin with, beyond the utilization of Fox Insight, which is a fantastic resource, but really it was a collaborative effort in developing this survey. This survey was developed, very early on when information about COVID and people's experience with COVID was really just surfacing and has been changing a lot, as we know even today. So it was a collaborative effort both among doctors. So we reached out to different types of physicians, infectious disease experts, occupational health experts, but also people with Parkinson's. And there were a lot of people with Parkinson's that were very ready and willing to test the survey, to weigh in and comment, and have continued really throughout the process, helping us understand some of the data and data analysis. So that really helped us hone the questions very quickly. So we were able to get the survey out by the middle of April. And then, people, there was a huge response. So just to focus on the questions of the survey, we really wanted to understand two aspects. So first of all, among people who actually were infected with COVID and had Parkinson's disease, and as well as those that did not, how that was affecting them, how their presentations of COVID were, how the outcomes of COVID were, and how it affected their symptoms of Parkinson's disease. And realizing that we were only going to reach a small number of those that could answer an online survey. But then we were also very interested in how the pandemic was affecting people with Parkinson's. I mean, pandemic has affected everyone in huge ways. And people with Parkinson's have a lot of different types of needs. They rely on a lot of outpatient services, appointments, physical therapy, exercise classes, support groups, that we really feel help their symptoms and are important. So we really wanted to understand how, were these being disrupted? Were people finding other ways to do it? If they were disrupted, for whom, and how it was affecting their symptoms? That was a big focus of the survey as well.
While prior research has indicated that people with PD may not be more likely to be infected or experience worse outcomes due to COVID-19, the recent Fox Insight survey results suggest notable adverse events such as motor and non-motor symptoms. Ethan, can you expand on these findings? How should movement disorder specialists manage these potential risks?
Sure. No, that's a great question. I think just to state that this survey really couldn't look at the risk of COVID in people with Parkinson's. That would really require a larger survey of people with and without. And as I said before, the people that answered this were obviously people that were well enough to come to the computer and answer this type of survey. We hope to maybe capture more people in the future, but for now, we captured either people that had recovered or people that were healthy from it. So we can't really weigh in on the risks of COVID in particular. We did look at outcomes, and they don't seem to be different within our survey in terms of severe outcomes, again, within this specific group for people with and without Parkinson's. But we did notice a lot of motor symptoms and non-motor symptoms that worsened. And I think that this reflects a common experience in people with Parkinson's, that when people get sick for whatever reason, especially with some type of infection, a lot of their symptoms may get worse. And in some cases, that may be the most prominent presentation of an infection even, is that a lot of Parkinson's symptoms suddenly get worse. So, it's a standard thing that, if a movement disorders doctor or a neurologist sees a patient with Parkinson's and their symptoms suddenly get worse, it's standard of care to think about an infection. And I think our research suggests that now, depending on where you are in exposure, that COVID should also be considered. And, that's not to say that as if your symptoms worsen, you have it, but it's something that your doctor may consider. It's, I think going forward, we'll understand, we expect these symptoms just with other infections to come down and to improve. And I think that's one of the goals of our follow-up research.
Vanessa, can you discuss what is the Fox Data Exploration Network, or FOXDEN? What information is represented, and how can it be leveraged by researchers worldwide within the field of Parkinson's disease?
Sure. So even during the pandemic, the Michael J. Fox Foundation remains strongly committed to working with urgency and determination to move these critical research programs forward. And we're confident that progress in Parkinson's research continues full steam ahead. And one of the ways that we are facilitating this is with Fox Insight's data portal, the Fox Data Exploration Network, or FOXDEN. This was a tool that was launched last year, and this is the tool that makes de-identified data that is collected from Fox Insight participants about their lived experience of Parkinson's disease available to the broader research community. So to date, since last year, more than 460 researchers are actively analyzing the data in FOXDEN. Given that some research facilities are temporarily closed, these analyses can also happen from home in the same way that the data collection can happen from home. So even in 2020, since the pandemic started, we've actually seen 170 more researchers sign up to get access to the FOXDEN data. So data analysis is happening, and the goal is to actually have these researchers make really critical insights about what is happening in the lived experience of people living with Parkinson's, so that we can further this research aggressively.
Just to build off that, Ethan, can you explain the significance of examining related implications of shelter in place and the threat of COVID-19 infection in the PD community?
Sure. Well, I think in general, there's been evidence before in a lot of studies into how social isolation affects people, how people's both mental and physical health may be impaired in those settings. And as I mentioned before, people with Parkinson's disease are very much related or reliant on or use a lot of ancillary services that may be affected by shelter in place. We're particularly interested in people with Parkinson's because of they rely on a lot of those services. Also because, they may be at risk of a lot of the, mental health implications of the shelter in place. So, people are very used to going out to having different support groups and having different support networks. And people with Parkinson's may be at risk of things like anxiety or depression. Those are both common issues in Parkinson's disease and may be exacerbated by shelter in place. It's also, we know how much people with Parkinson's rely on physical activity and exercise. And so we wanted to understand how, if people were able to cope with that with shelter in place, how much that was affected and if that was related to other symptoms of Parkinson's.
Similar to that found in the general data on the pandemic, low-income and minority patients with PD were found to be at greater risk of notable barriers to care, such as obtaining medications and telehealth use. Vanessa, how has the Michael J. Fox Foundation worked to advise patients who may be affected by these obstacles?
So the Michael J. Fox Foundation continues to strongly advocate for the expanded telemedicine and telehealth policies that people with Parkinson's require to make sure that the community is represented in negotiations about COVID-19 support efforts. I would encourage everyone to visit our website to read much more detail on our policy priorities at michaeljfox.org/policy. Parkinson's is such a variable disease, and what's important about this survey is that it actually highlighted some of the barriers and disparities in the access to care. And so to ensure that we are pursuing potential cures for everyone with Parkinson's, we need to include people who are from diverse backgrounds in Parkinson's research. And participation in Fox Insight is one of those ways that individuals from diverse backgrounds can begin their participation. Last year, the foundation also launched a new study that is focused on increasing the diversity in Parkinson's research, called Fostering Inclusivity and Research Engagement in Underrepresented Populations in Parkinson's Disease, or FIRE UP PD. And again, the goal of this study is to engage people of diverse backgrounds that have been historically underrepresented in research, to encourage enrollment in Fox Insight, as well as other Parkinson's trials that really need volunteers today. So that study is ongoing, and this is something that the foundation continues to prioritize.
Ethan, with insufficient data on how COVID-19 and PD interact, what further information is warranted to better understand this relationship?
Well, so I think there are several things that could happen. First of all, from our perspective, we're looking forward to repeating this survey at some point and trying to understand how these symptoms may change, but also, any symptoms that may persist, and also capture more people that may have been infected with COVID. I think what's really needed, and we haven't seen yet, is more of a systematic, maybe even prospective analysis of people both with and without Parkinson's disease, where you could adjust for equal levels of illness to really understand if people with Parkinson's are at any particular risk for symptoms of COVID or for being infected with COVID.
And lastly, are there any other concluding thoughts that either of you have that have not yet been addressed?
I would just like to encourage everyone with and without Parkinson's to learn more and get involved in Parkinson's research. First step can be to visit foxinsight.org to enroll as a participant. And for researchers that are interested in analyzing some of this de-identified data, I encourage everyone to visit foxden.michaeljfox.org.
Yeah, I would just second that. I think that Fox Insight's a fantastic way for people to get involved in research. And people that don't have access to a major medical center, and now in the setting of the pandemic, really for anyone, we're looking to understand as much as we can about Parkinson's. And for the survey is still open, so for anyone also to be involved in the survey.
To learn more, visit our website at ajmc.com. I'm Matthew Gavidia. Thanks for joining us.